Everyone, my name is Janelo Ligan from Sevilla, Bohol, Philippines. I am a masterand of University of Bohol, taking Master of Arts in Nursing, major in Nursing Administration and Supervision. I am currently working at Governor Celestino Galliaras Memorial Medical Center as a blood bank nurse since the year 2022. So this slide showcases the diverse environment of Bohol, Philippines, where my study is based and where I am affiliated with the University of Bohol, pictured here. Bohol is not only home to the unique geological formations of the Chocolate Hills and the adorable Philippine Tarsier, but also boasts beautiful coastal areas as you can see. This rich and varied setting provides an important backdrop for my study located in Sevilla, Bohol. Today, I'll be presenting my research study entitled Community Health Education Programs, Health Behavior Change, and Overall Well-Being of the Selected Residents of Sevilla, Bohol. For the background, community health education programs are critical for encouraging positive health behavior changes and improving overall community well-being. So this statement, supported by the Centers for Disease Control and Prevention, establishes the fundamental importance of community health education. It highlights that these programs are not just about providing information but actively aim to influence people's actions in ways that benefit their health and the overall health of the community they live in. So these programs addresses health disparities by offering easily accessible information and tools customized to different populations, allowing people to make educated health decisions supported by the World Health Organization. The gap that justifies the need for this study comes from a lack of understanding about the specific impact of community health education programs on health behavior change and overall well-being, especially in rural areas like Sevilla, Bohol. So this study is anchored in several theoretical frameworks to guide the analysis of variables. The first model, we have the health belief model developed by Rosenstock, Hochbaum, and Kegels in the year 1950s. It is a foundational theory in health behavior research that explains and predicts health behaviors by focusing on individuals' attitudes and beliefs. Individuals are motivated to take health-related actions if they believe they are susceptible to a health problem, perceive the problem as severe, believe that taking a specific action will reduce the risk or severity, perceive the benefits of taking action, outweigh the barriers, are prompted by cues to action, and have confidence in their ability to act. So in community health education programs, the health belief model can guide the design and evaluation of interventions by addressing this contrast. For instance, programs can increase awareness of health condition risks and severities, highlight the benefits of preventive measures, reduce perceived barriers, and enhance self-efficacy through skill-building activities and supportive networks. This approach can effectively motivate and empower individuals to adopt and maintain healthier behaviors. So the second model, we have the PERMA model, developed by Martin Seligman. It is a framework for understanding and enhancing well-being through 5 core elements: positive emotion, engagement, relationships, meaning, and accomplishment. Each element is essential for a fulfilling and happy life and can be targeted through specific interventions. For instance, positive emotions can be promoted through mindfulness practices and gratitude exercises, while engagement can be increased by providing activities that resonate with participants' interests and strengths. So, by integrating the PERMA model, community health education programs can address multiple dimensions of well-being, effectively promoting health behavior change and enhancing participants' overall well-being. This holistic approach ensures that interventions address not just physical health, but also emotional and psychological components, resulting in a more long-term and meaningful benefits in participants' lives. So the next is the Albert Bandura's social cognitive theory, which emphasizes the connection between personal variables, environmental effects, and behavior via reciprocal determinism. According to this theory, people learn by observing others, develop beliefs about their abilities, form expectations about the outcomes of their actions, have the knowledge and skills required for specific behaviors, and are influenced by the responses they receive from their behavior. So community health education programs can apply social cognitive theory by creating environments where participants can observe and learn from positive health behaviors demonstrated by role models or through peer-led interventions. So enhancing self-efficacy through targeting training and support ensures participants feel confident in their ability to adopt healthy behaviors. Additionally, reinforcing positive behaviors through incentives and fostering a supportive community culture can also further encourage and sustain health behavior changes. So the last model, we have the trans-theoretical model, which developed by Francesca and De Clemente, outlines the process of intentional behavior change through a series of stages. We have the pre-contemplation, contemplation, preparation, action, maintenance, and termination. This model emphasizes that individuals move through these stages of their own pace and may relapse, requiring a return to an earlier stage. So this model's principles can be applied to community health education programs which use stage-matched interventions to facilitate health behavior change and improve overall well-being. By understanding and addressing the stages individuals are in, these programs can more effectively recruit, retain, and support individuals in their health journeys. So for the objective of the study, the overarching aim of this research is to determine the relationship between the profile of the respondents to the extent of influence of health education programs on health behavior change and its perceived impact on the overall well-being of the selected residents of Sevilla, Bohol. Now, let's move on to how this research was conducted. This section details the methods employed to gather and analyze the data to address the study's objective. The study utilized a cross-sectional quantitative research design. This approach allowed to examine the relationship between respondents' profile, their exposure to the community health education programs, their health behavior changes, and their perceived overall well-being at a single point in time. The study was conducted in the municipality of Sevilla, where 366 residents have engaged in community health education programs. Used stratified random sampling from 13 barangays with different environments, each with varying access to healthcare services and resources. A non-parametric test was used for data analysis like the chi-square and Spearman's rank correlation. So for the results and discussion, This is the summary on the extent of influence of the community health education programs on health behavior change, arranged according to the rank result of the weighted mean. So the table illustrates the significant influence of community health education programs on residents' health behavior in Sevilla, Bohol. With an overall mean of 3.41, the respondents strongly agreed that these programs have a highly influential impact. Specifically, adhering to medical treatment, 3.44, utilizing preventive healthcare services, has 3.43, and adopting healthier lifestyles, 3.38, were all perceived as strongly influenced by the programs. So this table demonstrates that the effectiveness of health education in promoting positive health behaviors and encouraging proactive healthcare management. And then the results emphasize the importance of continued investment in community health education initiatives. No, such programs play a crucial role in enhancing health literacy, supporting preventive healthcare utilization, and promoting long-term healthy behaviors. Next slide is the summary of the perceived impact on the overall well-being arranged according to rank result of the weighted mean. So this table highlights the significant impact of community health education programs on various aspects of well-being with an overall mean of 3.43, indicating a high impact. Specifically, the programs had a notable effect on mental health and quality of life, having a 3.45, social connections with 3.41, and physical health with 3.38. No, so this finding suggests that health education initiatives play a crucial role in encouraging healthier behaviors, promoting preventive care, and fostering stronger social support networks, contributing to overall community well-being. Moreover, the high scores in mental health and quality of life underscore the effectiveness of integrating mental health support and social engagement activities within these programs. So the next slide is the significant correlation between respondents' profile and extent of influence on health behavior change. So this table presents the statistical correlation between various demographic variables and the extent of influence programs have had on health behavior change. The analysis uses chi-square test and Spearman's rule to determine the significance of this correlation, with p-values helping to assess whether the relationship between these variables is statistically significant. No, the results reveal that occupation, monthly income, and membership in health programs have significant correlations with the influence on health behavior change. Next is the significant correlation between respondents' profile and perceived impacts on the overall well-being. So the table presents the significant correlation between the variables occupation and monthly income and the perceived impacts on overall well-being, suggests that individuals in certain occupations and monthly income may experience a greater or more noticeable impact from community health education programs. This could be due to factors such as increased exposure to health information in the workplace or the ability to access and implement health practices are more effectively due to occupational settings. And another significant result is between the relationship of membership to health programs and perceived impact on the overall well-being. So this means that the respondents believe that the programs, clubs, or organizations have positively affected their overall well-being, showing that health education has an important role in improving not just behavior but also the quality of life. So the next table presents the significant correlation between the extent of influence and the perceived impact of community health education programs on the overall well-being of the residents. No, so the spermastro correlation coefficient of 0.883 indicates a strong positive correlation between the extent of influence and the perceived impact on overall well-being. This suggests that as the influence of community health education programs on residents' health behavior increases, their perceived impact on overall well-being also increases significantly. So the strong positive correlation indicates the community health education programs influence more residents to adopt healthier behaviors and practices, and the more they perceive these programs to positively affect their overall well-being. So this suggests that health behavior change as a result of educational interventions has a direct and positive effect on residents' perceptions of their quality of life. The next slide is the conclusion. So health education initiatives in Sevilla Bohol have played a vital role in facilitating health behavior changes and enhancing the general well-being of the respondents. These health education programs have been instrumental in promoting behavioral changes in the respondents. And also, as a result, these behavioral changes have influenced not only the physical health of the respondents, but also their mental, social, and overall well-being. So these findings align with the Albert Bandura's theory, the social cognitive theory, which emphasizes that behavior change is a dynamic process influenced by the interaction of personal factors, behavioral patterns, and environmental influences. Though the consistent delivery of community-based health education has lively enhanced respondents' knowledge and empowered them to make informed health-related decisions. This, in turn, has increased respondents' self-efficacy, thereby fostering sustained positive behavioral changes that greatly affect the respondents' overall well-being. In the findings of this study, several key recommendations have emerged to further strengthen the impact of community health education programs in the municipality of Sevilla. The first recommendation is focuses on the enhancement of health education programs or activities in collaboration of LGUs to RHUs. As an example, enhance activities especially in mental health and non-communicable diseases, then creates personalized programs for mental health awareness and infectious diseases, and then collaborate with the local health centers, barangay officials, and NGOs for wider reach. Next is to increase in accessibility and participation. The LG and RHU will train and mobilize the health workers to enhance health education programs in the community. Example, use different social media platforms and interactive sessions to improve comprehension among people with lower educational attainment and which also cannot personally attend to different programs provided by the LGU and RHUs. And then promote mobile health education programs in distant locations and remote areas. Next, target specific age groups and genders. For the younger population, promote digital campaigns using social media platforms, offer flexible schedules like evening or weekend sessions. For adults aged 63 years and above, provide health tasks in senior centers and distribute printed materials. For gender-specific approaches, create women-focused family planning programs and offer gender-sensitive mental health awareness sessions. Next, addressing socioeconomic barriers like LGU will lobby for additional budget for allotted for health, strengthening the linkages to NGOs and other multi-sectoral agencies to address the healthcare needs, advocacy awareness and the importance of different available organizations that will augment the socioeconomic status of the barangay. Strengthen collaboration among health workers. So barangay officials will encourage the promotion of local health committees that actively involve community people in the planning and implementation of health programs. And also, there's increased community-led health programs emphasizing and focusing on the significance of preventative health care and regular medical checkups. And the DOH and LGU will strengthen collaboration among health workers. The last recommendation is monitoring and evaluations. So implement regular feedback mechanisms through surveys and focus group discussions and establish measurable goals for increasing participation in health programs and track program effectiveness through pre- and post-education assessment. So the last slides are the list of the references that were cited throughout the research. And this concludes my presentation on the impact of community health education programs on health behavior change and overall well-being of the residents of Sevilla, Bohol. I would like to thank you everyone for your time and for listening, and I hope you found the presentation valuable. Wishing you a great day ahead.